Welcome, guys, to another episode. I'm excited tonight because I've got a special guest who's going to be talking to us about dental therapy. And Google search dental therapy or YouTube dental therapy. You won't find too much information. So if you've been thinking about the different career paths within dentistry, or maybe you've heard of dental therapy and you want to know more about what it entails, then this video is for you. So without further ado, I want to welcome our guest today, Ibrahim Newman, also known as Ibi, who will be talking to us about what life is like in his shoes. So no, thank you for being with us tonight.
Oh, thank you. No, thanks for having me. It's an absolute pleasure.
Yeah, so just tell us a little bit about where you're based, and in terms of, work as well. Is work nearby? Just tell us a little bit about where you're based.
Yeah, absolutely. So currently based in sunny Brighton, and been here for about 2.5 years, just over 2.5 years now. Prior to that, I was in London, and actually about 3 months ago, I was still commuting to London 2 days a week to work in Fulham, southwest London. So finally, after a long time, the commute caught up with me. Thank you to the train strikes, which made things very, very difficult. And it was time for me to just be fully based in Brighton now, because the commute was just taking a lot out of me. But I work in Brighton across 2 practices, carrying my full scope, which I'm sure we'll get into in a moment. But
Yes, definitely.
Yeah.
If maybe we just start then at how you even landed within dentistry, because that in itself is something. Not many people grow up and decide that dentistry is the pathway for them. So how did it happen for you?
Well, if you were to ask this question to my mum, she would tell, I always knew he was going to be a dentist, because she was a beauty therapist, and I used to play with her wooden spatulas when I was a kid. And she said, I knew it. But the honest truth, I didn't even know. It was an interesting journey. I left college and went into uni, not really knowing what to do.
And whereabouts were you at this time? Sorry.
I was based in East London, so I went to University of East London, and I was always stronger and enjoyed more the science subject. So I knew I wanted to go down that route. Without giving away my age, it was at a time where CSI was quite popular on TV. So I was like, forensic science, that's exactly what I want to do. And went in to do a degree in forensic science and applied biology. And sort of 2 years in, just realized that it wasn't for me. And kind of took a year out to just try and decide what was best for me. And I was speaking to one of my friends who I'm still very close friends with. And I said, I definitely want to interact with people, but I have no idea what to do. So when I took a year out, I did an NHS application form. And if anyone has gone onto the NHS jobs website, they will see that you kind of create your application form, a personnel statement, and then you just submit your application to many different roles. So I was in the wormhole of clicking apply to many different jobs and didn't really realize that one of those applications was to do dental nursing at the Eastman Dental Hospital. So they got back to me, and I was like, dental nursing? So the first thing I did was, is there any male dental nurses in the UK? So typed that into search and saw that there was. So that was reassuring. Went into the interview and thought, why not? I'm kind of at a standstill in life. I'm taking a gap year out of university, and I why not explore something else and see if this works for me? And as soon as I got into the dental world, I realized that you either really like teeth or you don't. And I was just one of those geeks that really enjoyed every aspect of dental nursing. So I started my dental nursing back in about 2010, I think it was, 2010, 2011. And I did dental nursing for a long, long time. I think it was about 5-6 years. And in that time, I always wanted to develop my skills. So I wanted more and more. And I did a diploma in oral health and also in dental radiography. And then the next step really from dental nursing for me was to decide whether I wanted to go for dentistry or if I wanted to go down the dental hygiene or dental therapy route. And then there was another spanner in the works where orthodontic therapists was also up and coming around that time. So I had to decide which route to go by. I completed my degree. I did go back and finish my degree, but I dropped the forensic science and I just did a degree in applied biology. And I decided that I didn't want to do another 4 years because I would get a postgraduate entry, even though I've got my degree. I had to do another 4 years to go into dentistry. And when I looked at the dental therapy scope, I said, well, this isn't really that far off dentistry. I know you could do a lot more in dentistry and specialize in different fields, but the scope that was there in dental therapy kind of ticked the boxes of what I enjoyed as a dental nurse. Working in general practice and kind of just doing general dentistry and especially working with kids. So I think for me, it just made sense at that time to go down the dental therapy route.
Yeah, can I just ask there, because you spent quite a few years as a dental nurse. Was that solely within the hospital setting, or did you get an experience in general practice as well?
It was all hospital based, and I absolutely
tell us a little bit about that, because that's different in itself.
Yeah.
Just tell us a little bit about that.
Yeah, that was absolutely amazing. I met some amazing people. I worked my way up and started assisting some professors, and I kind of worked in many different departments. So I did a couple of years in the endodontic department, and worked with some specialists there, and then moved on to oral surgery at some point, and did a bit of pediatrics, and kind of finished off my dental nursing in the orthodontic side of things, which I really enjoyed because there was days when we'd go over to UCLH hospital and do some maxillofacial surgeries, etc. So you're getting stuck in, scrubbed up in theatre and doing some amazing surgeries and changing people's lives, which was absolutely amazing. So yeah, I was very fond of it, but I never really I had sort of 2 weeks as part of my training program away in a dental practice to get a feel of general practice, but I was always in the hospital setting in London, which was absolutely amazing. I loved it.
So just for those that don't really know about the setup for general practice or a dental hospital, what's the feel like? What's the typical day-to-day like working as a dental nurse in a hospital setting?
I would say it's a bit of a slower pace compared to general practice. And the Eastman Dental Hospital was only accepting referrals. So these are patients that cannot be seen in a general practice, whether they're anxious, whether they're nervous, whether they have a complicated medical history, or whether the dental work is just out of a general practice's skill set, equipment, whatever it may be. So we kind of had a lot more time to see a patient. I mean, keeping in mind that a lot of the people that you work with are also studying to specialize in a particular field. So I could tell you that there was a number of occasions that I will doze off while assisting in the root canal because you would literally see 2 patients a day, 4 hours in the morning, 4 hours in the evening, and it's a 1 4-hour patient. And I mean, the clinician, I'm sure it wouldn't feel 4 hours for them doing that root canal, but for a dental nurse standing there assisting, it was tough to stay awake sometimes. But no, it was amazing times. But yeah, I mean, overall, I'd say it's a much more slower pace and dealing with some complicated cases, challenging cases, which I really enjoyed because you really didn't know who was coming through the door.
No, thank you for that, because I think a lot of people that are potentially thinking of nursing and thinking, should I do it in general practice or hospital? This will be really good for them to have a little idea of what to expect. Okay, so you then decided, there's orthodontic therapy, there's hygiene. You've decided that dental therapy is the direction you want to go with. What's it like applying for dental therapy? What are the typical requirements? What do you have to put together? Yeah, what's that process like?
That was tough. So I started applying in 2015. And my first year's applications I did through UCAS, and I got rejected, didn't even get an interview from every single university. And it was a time in life where I went through some personal things in life, and I just wanted to change. So I didn't want to study at the Eastman Dental Hospital. I thought this is a great opportunity to start fresh. So I applied to Cardiff, I applied to Tyneside, I applied all around the country. And they all replied with the same email saying, well, you've got a degree already, and we kind of prioritize, because it's competitive, we do prioritize undergraduates to this position. So then I started looking down different avenues and started applying at dental hospitals that run diploma schemes instead of degree-based schemes. And I was applying around London for those. So it was Barts, King's, and the Eastman. For Barts, I think the application process opened at a different time compared to Eastman and King's. So I already got a reply from Eastman and King's and decided to go with Eastman in the end. But it was with the diploma scheme, I think they don't just look at, all right, so this is what you've studied and this is your grades and this is what you need. It's more very small intake. So I think King's take 30 students a year. Eastman take 10 therapists, or they used to. Now it's a degree-based scheme, but they used to take 10 therapists and 12 hygienists, I think it was. So, you're competing. If you're applying for therapy, I'm sure there was over 100 applications, and you're trying to get one of the 10 places there. So they kind of focus a lot more on what your experience is like in dentistry, what your manual dexterity skills are like. And there's a lot of questions and sort of stations that were set up at King's Hospital, especially to try test these sort of things, your instinctive thinking and manual dexterity skills, etc.
Just to make a generalization here, would you say that the degree route is more for if you're coming out of college and applying, and then the diploma route is if you've maybe done a degree before or have quite a bit of experience in the dental field, maybe dental nursing? That's sort of the route that people take. Is that a fair generalization?
Yeah, I think that's definitely how it was. How it is now has changed, and I'm sure it's going to change in the near future. I mean, there's talks of apprenticeships coming in, and I think it's at the end of this year, there's even an apprenticeship scheme for GPs coming in. So I'm sure that we're going to start seeing that transition, from what I've heard, into dentistry, dental hygiene, and dental therapy, where there's these government-based apprenticeships. But in terms of dental diplomas, if I'm not wrong, do not quote me on this, but if I'm not wrong, I think there's only Essex University that's still offering a diploma scheme. And the rest have all moved on to a degree-based scheme now. Even the Eastman, I think it was 2 years after I left, maybe it was 2018, if I'm not, no, 2020, just before COVID, I think it was, they moved over to the degree scheme, and they've collaborated with South Bank University. So you're still based at the Eastman Dental Hospital, but you're part of the South Bank University, and that's where applications go through. So it's all done through UCAS, if I'm not wrong now. So the diploma scheme has been phased out, and obviously that's a big thing, because that's where it all kind of started from. I'm not sure if you're aware of the history of dental therapy, but we could go into that as well at some point. But yeah, that's kind of being phased out at the moment.
All right. So potentially, if you were applying today, it might not be straightforward for you.
No, I mean, from what I know, if you're applying today, it's all done through UCAS, and all applications are going through UCAS at the moment. And it's always going to be a very competitive and difficult industry to get in. But my advice is don't give up. I mean, like I said, I applied and got rejected from every single one. But you kind of need to learn to take that on the chin and keep going. Don't take it personal, and just look at different ways you could either improve on your experience, whether that's observing or whether that's doing extra post qualifications in your dental nursing, or even doing dental nursing if you're not involved. Just something along those lines is definitely the way to go.
Yeah. So when I went to university, my first degree was a science degree in Leicester, and then I decided to go on to graduate entry dentistry, 4 years in UK and Preston. And I realized there's a big difference between my experience of university the first time round. Second time round, I wasn't thinking about socials or anything like that. It was just straight to business. So I want to know from you, what was your experience of uni like first time round? And then what was it now like? Actually, no, for the diploma, when we did the diploma,
it was two. Like, I completely agree with you. It was two different experiences, and I think a lot of that is to do with where you are in life as well. And when you commit, like you committed an extra 4 years, I committed an extra 3 years post what we've already done. You kind of in the mind frame of, right, okay, well I've done what I did. I had my fun. It's time to put my head down and do what I'm here to do, really. And that's exactly was my experience. I mean, first time round, freshers year was obviously absolutely amazing. It's loads of time to do your socials and meet people and parties, and student loan coming in. And I was studying in London, so I was living in London at the time. So student loan for me was go out and have a great time. So it was, I was quite fortunate on that front. And I didn't have a lot of travel expenses to commute on either. So I had a great time my first year. And the second year, it was head down. And Eastman was a bit of a reality check as well. It was a great experience. And I still keep in touch with a lot of my colleagues and also tutors at the Eastman. It was a brilliant experience, but it was serious. And it was definitely the hardest thing I've ever done in life, hands down. It pushed me to, wow, yeah. I mean, with uni, the first time around, I think the difference was you sort of study a module and you get tested on that module. Whereas with the diploma, it wasn't that. You study for 3 years and then you get an exam, and you basically could get questions, which were short answer questions. I say short answers, but you spend sort of 20 minutes on each answer. And you've got to write everything you know. And that question could be related to the first year, something you picked up when tooth development, or it could be related to a medical emergency. It could be related to absolutely anything. So you just had to have all this information in your brain. I mean, I don't think I even visited the library when I was at university the first time round. I think I was just one of those people that if I had an exam, I'll go home, I'll revise, I'll go into my exam and just get on with it. Whereas at Eastman, I practically lived in the library. So yeah, it was a big reality check between the two, I think.
So I want to pose this to you then.
Go on.
Let's say you went into dental therapy straight from college, as opposed to how you've done it, where you've had a science degree, you've worked as a dental nurse in the hospital, had all these experiences, then you've done dental therapy. Which IBI is the better clinician? Do you think it makes that much of a difference in terms of your journey to getting into dental therapy? Yeah, well, just give me your thoughts on what you think about that. Basically, what I'm saying is, should vocational careers like this entail you doing a first degree just to get some life experience, or maybe a job to get some life experience before getting into it? Or should we just keep it as it is, where you just go straight in and maybe you find out you don't like the career, or it gets confirmed that you do like the career? What are your thoughts?
I honestly believe that this is very sort of person dependent. and it just depends where you are. But from my perspective and what I've been through, I mean, my first job, I've got skills that I've learned in. I mean, I used to be an assistant manager at Krispy Kreme donuts, so I've lived through many different jobs. I've did some labouring and decorating in my uncle's business. You know, I worked in retail, I worked in food and coffee, and there's skills that I've taken from every single career that I've gone down or job that I've gone down, and also in life, in traveling and meeting people. um, it sort of changed me and molded me to who I am, I guess, without getting too deep. To feel like I've got a bit more of a personable side to offer to patients, I hope, and I could understand where they're coming from. Because I feel like sometimes in dentistry you can sort of go down a tunnel vision route. You know, you're seeing patients, quick turnover, and you're like, well, you know, you need to, for example, I recommend that you get this filling done, and the patient's like, well, it's not the right time for me, and it's like, well, okay, but you know, why would you not get a filling done? You know, it might not click at that point, but then when you start speaking to the patient and they explain to you that they've got other priorities and maybe other health priorities going on, a tooth is the last thing that's not giving them any pain. It's the last thing on their mind. And these are things that may have not clicked for me early on if I just jumped straight into it. And also on the dental nursing side of things, I think a dental nurse's role is absolutely huge in my everyday life, me working as a dental therapist. So the skills I picked up as a dental nurse in talking to patients, nervous patients, you know, being organized. I was your typical teenager, you know, messy room, etc. And you know, it's the complete opposite now. As soon as I got into dentistry, I've sort of got borderline OCD, I'd say. It's you pick up these things and organization skills and timing and time management, should I say. And it's yeah, for me, I feel like I had to go through what I had to go through for me to be where I am today. Yeah.
My personal belief is, you know, the more life experience you've had, it just means that you're serving people outside the clinical and on a human level as well. And it just shows. You can see with clinicians who really have that EQ with their patients. So yeah, I was similar in that I had different roles. Worked as a social worker, social support worker. Worked as the tutoring and as an HCA, healthcare assistant as well in the hospital wards. And all of that just allowed me really to understand people a bit better. So that when someone comes in, for example, I had someone on Friday, a gentleman in his 90s, and I can tell that things aren't quite right, and I'm probing. And then he says he's been told he's got 6 months to live. You know, the last thing on his mind is going to be, you know, certain diagnoses that I come up with. You know, he's thinking about, I've just been told I haven't got long to live. So then that whole appointment is different, you know. How I approach it.
You're not going to say to the patient, well, you know, you really should be flossing, or you know, there's ways that you approach things, and and that's one of the things that I'm sure you'd agree that I love about my job as well. And it's the evolution of dentistry as well. You know, how much because if you go back many years, and minimally invasive dentistry wasn't even a thing. Prevention wasn't a thing. You know, you walk in, you're in pain, you get a fill in or you get the tooth out, and you walk out the surgery. And I think that whole attitude has started to change, and I think that's where the approach from patients has also started to take a bit of a shift. I'm sure you would have noticed as well, but I'd say I'm not really, I still do get people walking in saying the first thing they say when you see them, hi, how are you? I hate the dentist. Yeah, great. You know, you still get the odd one, but it's not as often. You know, I do get people coming in that are happy to come in now and happy to see you for their routine treatment instead of visiting the dentist or visiting the dental surgery for the reason that they're in pain or they need treatment.
Yeah. Now, the thing, because you've had such a varied life experience, we could keep going down that pathway. But people want to know about, the day-to-day of dental therapy. And I've been enjoying it. But I want to now
we'll need a separate one for that. We'll have to do a separate that. Yeah, definitely.
So you talked about geeking out at dentistry, and I want to now just tap into what is life in your shoes like day by day? What are you getting involved in? What are you doing? What excites you about what you do?
Look, I'm extremely busy, but I've always been that type of person that takes far too much on when they shouldn't. But one of my passions is dentistry and dental therapy. So I work alongside the BADT, which is the British Association of Dental Therapists. And I have been doing that for over 3 years now. I'm the London and South East representative, but I also do some of their sort of advertisements on social media and newsletters, and getting involved in. We just had our conference in June, so getting involved in planning and organising the conference. And just being there for BADT members and spreading the word out on dental therapists and implementing a lot of the changes that has happened in dental therapy. So that's all voluntary. Everyone in part of that association are all dental therapists that work in dental therapists that just do that because they love dental therapy and they want the career to progress. Yeah. So I take that on, as well as working 2 days a week in Brighton, as a dental therapist using my full scope, and also in Hassocks, which is literally a 15-minute drive just off Brighton, and do my full sort of day there. They're both private practices, both very, very different private practices. One is sort of the younger demographic. I have a lot of pediatric patients at the dental health spa. I have a lot of pediatric patients and do mainly sort of your routine extractions there for pediatric patients, examinations, dental hygiene visits, treat gum disease, and I do a lot of cosmetic work there with composite bonding, etc. At my practice in Hassocks in Hurst Dental Clinic, it's more a very heavy restorative based practice. Some hygiene. So I have one hygiene day where I'm just completely committed to hygiene and treating perio patients and your routine oral hygiene visits. And another day where it's just dental examinations and heavy restorative based patients. So these are patients that, previously have had loads of amalgam fillings in their teeth, and, they're coming to that stage in life where we need to start retreating those teeth, etc. So yeah, that's basically my working day. And if I do get any time, I tend to watch a bit of football when that's on, but that's rare.
And I saw on your profile was that you're an Arsenal fan. I was like, you know what? I love Arsenal football. I'm a Man United fan, but I love Arsenal Football Club. They make football so enjoyable for me.
We've got a weird relationship.
Arsenal fans, man, I don't know how you do it. You get so excited, and then things always just wheels just fall off at the end, But
and it do you know what the best way to describe it? It's kind of like dentistry, right? There's days at work where you feel on top of the world. You're like, wow, that was amazing. I've done that with 10 minutes to spare. It looked great. Patient was happy. I love this. I'm great at it. And then you get the next patient in or the following day and you're like, what am I doing? I can't do this. I'm just so challenging. Am I even the right person for the job? That's basically being an Arsenal fan, right? In a nutshell. So it's the same thing. So I think I'm just kind of used to it, and I've transferred it into my normal life as well, my normal working life.
You talked about working with the BADT.
Yes.
So just let us know a little bit about, has there been a change in the scope of therapists over the past few years? Just give us a brief rundown of that.
So, I mean, originally, dental therapists weren't called dental therapists. And prior to that, we were called dental dressers. If you want to Google that, and you could picture me in a white dress as well, long white stockings, go for it. But that's what we were called initially, and it was introduced just after the First World War, where the caries rate was obviously very, very high. And it didn't really work out. You know, it was across the country in a few places, and it just didn't really work out. So the government scrapped it. And then it came back as dental auxiliaries, which was a scheme, looked at dental nursing scheme in New Zealand, actually, where dental nurses there carried out a bit more in terms of the scope of dentistry. And the government looked at that and introduced it here in the United Kingdom in 1960. New Cross Dental School was where you would do your training. I think there was 60 students. It was all ladies that would go, dental auxiliaries. And it was up and running for a little while, and it wasn't until 1973 that the name change got put forward. And that was actually voted by BADT members. So BADT was formed in 1963, and the members voted for dental therapy as our new name, and we were known as dental therapists. And then it wasn't until 1997 when the ball really started to change, and we extended our duties. So up until then, you wasn't able to do an ID block, for example. You wasn't able to do pulpotomies on pediatric patients. And it wasn't until 1997 that got introduced. And again, that was with the BADT doing a lot of work and being absolutely instrumental in that. So everyone that graduated prior to that would have had to retrain in ID blocks and pulpotomies in order to do that. And then you were mainly working throughout those years, you was mainly working in a hospital or community-based areas. You know, general practice, there was no job opportunities for dental therapists. That changed in 2002, where a dental therapist could work in general practice and also own a dental practice. I work at Dental Health Spa, which is owned by a dental hygienist, which is absolutely amazing. And then it wasn't until 2013 or 2011, the project started with BADT and BSDHT, the joint project for direct access, which basically means a dental hygienist or a dental therapist can see someone walking off the high street without that person having to see a dentist. And that got introduced in 2013. However, that was only for private patients. So if you was registered to an NHS practice, you'd still have to see an NHS dentist who would then refer you on to a dental therapist that will carry out the treatment that was treatment planned by the dentist. And obviously now that's also changed. There's been some changes. It's all still very grey, and there's not much. It's sort of, it's, how could I say this in a politically correct term? It's been introduced, and some practices are flying with it, and dental therapists are just cracking on and doing exactly what they should be doing. And other practices are still treading with caution because dental therapists don't have a performer number, which means you're still carrying out that treatment under the dentist's performer number, which complicates how that clinician will get paid and etc. So it's still a very grey area, but nonetheless, I mean, if you look at where we were in 1960 to where we are now, it's such huge progress, and hopefully it will continue to progress, and we'd get more dental therapists working in general practice and carrying out their full scope.
Yeah, love that. That's a beautiful history. I've learned a lot there, you know, from dental dressers and auxiliaries to the direct access that we're all aware of now. Yeah, I didn't know some of that, so no, thank you.
No worries. No worries.
I'm just gonna get my charge of my laptop because it's saying 8%.
Right, yeah, we need that.
Yeah, no, this is great. Really, really informative. I want
Thank you.
to just start to focus in on the practicalities of getting your first job or your first set of jobs
Yeah,
outside of qualifying. So for those that are maybe still training,
yeah,
so
yeah,
to get a little
absolutely.
bit more on that, and maybe even the
Yeah,
whole discussion of self-employed, employed, how to
yeah,
navigate that as a
yeah,
therapist as well.
yeah,
Okay, so I just want to take it back to when you were now about to qualify and you're thinking about, you're going to be applying for jobs. What does that
yeah.
look like? What's that process like?
Um, I think one of those, you're quite fortunate in the dental pathway. I think that there is always job opportunities. The difficulty comes in when you're looking to do a dental therapy job, but all the applications are advertising for a dental hygienist, or they're advertising for a dental hygienist therapist, which is a term that I don't agree with, because I'm qualified as a dental nurse, but I wouldn't call myself a dental nurse hygienist therapist. I'm a dental therapist, which allows me to do all those things. And when you go and look at these job opportunities and have conversations, they're hiring for a dental therapist or a hygienist therapist, and then you realize that you're actually just doing hygiene. And at that point, you need to decide what's best for you, right? So my initial thing was I started my job application process. I started looking on just, Indeed and Google and LinkedIn. Facebook groups are absolutely amazing. If anyone out there are looking for jobs, I found two amazing practices through Facebook groups for UK jobs in dental hygiene and dental therapy. And as I'm sure you'd agree, Arnold, as well, I mean, that networking in dentistry is so important, and it's such a small world, right? So just go out there, network, socialize with people, go to conferences, go to courses, and meet people, because you never know when you're going to cross paths again, and it's really good to do. So I applied for a job, and they wanted me there for 3 days for hygiene, but I was like, no, I just need one day, because I knew that if I did 3 days, coming out of dental school and studying 3 days, working 3 days and making money again, I don't know if I'd be able to get out of that cycle. Whereas if I worked one day a week to start with, doing dental hygiene, I'll build my softer skills, time management, organization, out in the real world. Um, Gives me that confidence to start seeing patients and then find a job in dental therapy. And that was exactly what I did. And I was adamant, and I did that for a couple of months, working one day a week, which was tough financially. Believe me, I made a lot of sacrifices. Um, and then I went for a dental hygiene job interview at Fulham, and she queried what a dental therapist was and what I can do, which is very common. A lot of dentists don't know what our scope is and what we're actually able to do, and also what I'm comfortable doing, because I might not be comfortable doing certain things in my scope. So she queried that, and we kind of implemented it slowly into my working life there. And that's where I think you need to sometimes not just shut down a job for dental hygiene, because if it's the right practice for you, then you can build it into dental therapy. And that's something I speak to students about often and tell them, it's all about building a rapport with your practice, with your patients, because if a dentist doesn't know what a dental therapist can do, a patient isn't going to know. you know I mean, recently the prime minister came out and referred to us as therapists, or whatever they called, and that sparked a massive thing on social media, on Twitter, and they said, what, people were saying, what, are they going to talk to my teeth? And that whole thing started again. So it's very important to build that rapport and trust with your patients. So you might need to do hygiene on that patient for a year or two before that patient can trust you to do a fill-in, and you can't take that in an offensive way. That's absolutely understandable. So
Few
that's
things that you
how the
said there that I wanna unpick. So
yeah.
the first thing was that you talked about taking just the 1 day a week role, doing the hygiene because you knew you wanted to be using your full scope and you waited for
Yeah.
the right opportunity to come up. So was that an education you had from your course, or is that something that you just decided? How did that come about? How did that thought even start?
So for me, that thought was like we said when we were talking about my studies, it was the hardest thing I've ever done. And I just thought to myself, I pushed myself and I failed my finals the first time round. I failed one written paper, which meant that I had to retake absolutely everything again. And that was an extension of 6 months. And it was the best thing that happened to me, I promise you, because at that point, I thought I was untouchable. I thought, oh yeah, I'm going to be the best dental therapist in the world. And that was a massive reality check for me. And going through those extra 6 months and studying and retaking absolutely everything again was something that I just thought, I can't put that to waste. I've just studied as hard as I can to get what I want to do. I finally found something that I really want to do. I'm not just going to do part of it or some of it. And that's no disrespect to my fellow dental hygienists or dental therapists that are choosing dental hygiene. Just for me at that time, I just thought I need to do my full scope. I want to do my full scope. Even that was scary and I was nervous about it. I just felt like I had to do it.
Yeah. And
Yeah.
were you seeing more posts in general for employed roles or self-employed roles? And how did it work? So you started talking about having this conversation with one of the clinicians about what you're comfortable doing and the scope of practice. But how does that work actually getting a self-employed or an employed post? And yeah, just talk to us about the practicalities of that.
So more and more practices nowadays are moving down the employed route. And what you need to find, mainly when I was applying, a lot of the roles, I'll say 90% of the roles, even 95% of the roles that was advertised was self-employed. And what that basically means is you work on a percentage basis. So you see a patient, you get a percentage out of that. And you do your own tax returns and you don't get any holiday pay, you don't get any sick pay, and you do what you need to do. So depending on how much you do, you will get rewarded more for what you do, which works great in some practices and it works great for some people. And then the employed route is slightly different because you do get annual leave and you get paid for your annual leave, but you'll probably be just getting a fixed salary no matter what you do, whether a patient shows up or doesn't show up. And there might be a pension scheme. There might be, depending on where you work. If you're working in the NHS, there's great schemes in the NHS with pensions and etc. So you kind of need to find out what's best for you at the time and what job opportunities you have and weigh up what works for you. For me, I've only ever worked as a self-employed clinician, and that was a reality check as well in itself, just doing your own taxes, which I was not great at. So I got an accountant and you got to counter in that cost. Managing your finances so you can take some time off and go away on holiday and not worry about pay and things like that. So I think there's pros and cons on both sides. You just need to work out what's best for you and go from there, really.
Yeah. And then in terms of if it's self-employed, do you have some form of negotiation there in terms of deciding what that contract looks like? What's that experience like?
Absolutely. I mean, I always say to people, you need to understand that when you qualify, it's like passing your driving test, right? You don't know how to drive. You've got the certificate, but you don't. You learn how to drive once you start driving, right? And you have a few bumps and chips and grazes on your car, but you keep going, right? And it's the same thing. So I think you need to go in with an open mind. A lot of students nowadays, with social media, I feel like a lot has changed as well. And, you know, I'm a massive social media advocate, by the way. I think it's great. But also the downside of social media is people only post the amazing and the great things on there. And, you know, if you see a therapist or a hygienist that is flying, they're on 40% and they're living a great life, it's not because they just walked into that job out of dental school. It's because they've worked very hard to get there. And it's the same principle when you leave. You need to understand that you need to be open, but you want to negotiate. But at the same time, you need to understand that you've just graduated. So you're probably going to get a percentage basis that's a lot lower than someone that's been qualified. I've only been qualified for 4 years, over 4 years now, coming up to 5, but I'm still learning every day. I mean, and I'm sure in 10 years' time, I will say the exact same thing. And I'm sure you'd agree with that, right? We're learning every day. We learn something new absolutely every day. So I've done a lot of courses, postgraduate courses since I've graduated, which allows me to do more things, and I'm more competent in more things in my scope. In September, I'm starting a postgraduate qualification in restorative and aesthetic dentistry. So I'm adding more onto my CV. So when I go into a job opportunity, if I ever do change job, I can be in a position where I can negotiate and say, well, look, this is what I can do. But if you've just come out of dental school, I think that negotiation is absolutely important. You know, if you've got to commute 2 hours a day to get to this job, then yeah, you need to make sure that you're getting paid a decent amount for you to be able to cover your commute. But at the same time, you need to understand your skill set and where you are. The most valuable thing, in my opinion, is finding a mentor. That's better than any percentage. Any percentage. Find someone that will mentor you, put their arm around you, have your back in dental practice, teach you and support you through seeing your patients. And if you've got that, that is worth more than absolutely anything in terms of percentage basis. If you said to me, I'll give you 80%, right? But you're just in your own, you've got no nurse, crack on, you're getting 80%. And you said to me, no, actually, we're a team practice, you're getting 30%. And, you know, we work together, it's a multidisciplinary practice. I want you involved in all our treatments. I'd go for the 30%. That's so much more valuable.
Yeah, no, thank you for that. You then talked about the fact that it's good to discuss with the clinicians there what you're comfortable doing and how you work. Just talk to us about the importance of that, really getting to understand each other as clinicians, because it's only until maybe the past 10 or so months that I'd worked with a dental therapist in the same clinic. So it was very alien to me, and I was asking her, so how do we do this? How can we work well together? Because I'd never had that experience before. And I think things are changing with dental schools, in that some dental schools have therapists working in tandem with the dentistry students as well. So just talk to us about the importance of having those discussions with other clinicians.
So important. And my advice is, if a clinician doesn't have that discussion with you, you have it with them. Because communication here is key, right? And everyone feels more comfortable doing something than something else. And your instant sort of your human reaction to that is to be like, well, I'm not really great at doing this, so I'm just not going to do it. So if I don't get any referrals for, I don't know, a deep carious lesion or a class 2, for example, I don't know, anything, and I don't feel comfortable doing it, then I'm happy with that. I'll just carry on doing what I'm doing. And if you kind of don't communicate that, then you could get stuck in doing what you're doing and maybe even burn out eventually and not enjoy what you're doing because you don't have the variety in your job that you should have or you could have. So my advice will be definitely communicate it with your clinicians, tell them what you're comfortable doing, if you've got time, observe them doing something you don't feel comfortable in. Talk to them, pull them at lunchtime and ask them, how did you get on with this? What did you do? They might do something different to you. I'm like we were talking about earlier, I nerd out. I do as many courses as I can. And even if I just pick up one thing from one course, that's good enough for me. If you could just pick up a little skill from every single person, you could kind of mold yourself into your own clinician, right? And it's the same thing with the people you work with. Don't just see it as work, it's a learning environment. So communication is the big thing. And you just need to go out there and talk to people and say, look, I'm a dental therapist. This is what I can do. I think I'm really good at doing this, but I'm not so confident in doing this. And I'd like to develop my skills in doing this, and just find the common ground in dental practice.
Yeah, no, I definitely agree that communication is so key. I remember there's one patient that me and the therapist had both seen, and the therapist was just saying that this patient, they need this and this fill in just when you see them for the checkup. And I was like, hey, do you want to do the filling? Because you've seen the patient already, and you seem to have built up a rapport with the patient. I've seen the fillings that you've done on some other patients. Look great. Go for it. Yeah. So I think that communication is key, and even for dentists, for our side, just being able to get to see the work that therapists are carrying out to a high standard. I was looking at one of her posterior composites, and I was thinking, hey, I couldn't have done a better job.
And I think dentists need to understand the value in it as well, and it comes with that as well, because not only does it have a patient benefit where you build up a rapport with one clinician, but for the dentist, I think the time aspect is so important, right? So as I'm sure for you always struggle with that, right? Time.
Yeah.
So if you can offload some treatment to a patient, for a patient to a dental therapist, and that gives you more time to do what you'd like to do, what a dental therapist can't do, whether that's crowns, onlays, clear aligner treatments, orthodontics, oral surgery, whatever it might be, you could give yourself to that because that's what you want to do. And then all of a sudden you've got this very happy environment in the practice because everyone is doing what they want to do. And it's great.
Yeah, no, it's beautiful and it works all together. So I've seen that you do have an interest in cosmetic dentistry. You do, I've seen some of the edge bonding and the composite cases that you've put up there. How did you develop into that?
To me, I had to sort of tap into general dentistry first and kind of learn my trade in that first. So before I went, I didn't jump out of university and just dive into cosmetic dentistry. I practiced my skills on your traditional general dentistry, working with composite, molding composite, and building posterior and just general dentistry, and working on children that are wriggling around and moving around and the saliva everywhere, and you just develop all these skills. And then I'm very close friends with Milad Chadru, also known as the Singing Dentist, and he was running a course with Avant-Garde Dentistry for composite veneers. So he was like, come along. And I just thought to myself, why not? I love a course, let's do it. And went on. And then that's when I started understanding cosmetic dentistry a bit more, and sort of started to realize that I do have a significant interest in it, because I went through sort of braces treatment myself, and I realized the difference it makes with the confidence you have when you smile. And I used to laugh and hide my face, and so when I see these patients and they're telling me the same things, it kind of resonates with me. So that was one of the things that I realized. And then what I started to really enjoy was not actually just doing the work, but the treatment planning side of things. So finding what the patient's expectations are, how to manage those expectations, the scanning, the planning of everything. And that's what I really started to enjoy. And that's when, once I done that course, I did a case pretty soon after that, and then the cases just kept coming in, and yeah, that's where I've gone. But just saying it, putting it out there, there's a lot of cases I say no to as well, and I think that's something you need to know as a dental clinician as well. And because cosmetic dentistry is a different world, and you do meet patients that their expectations are also almost demands, and you need to be very careful what you promise. And if you feel like you may not be able to meet those expectations, you need to be man enough to say, look, I don't think I'm the right clinician for you. And that's how I really got into cosmetic dentistry.
I want to ask, what's next for you? You seem to be getting involved with a lot. BADT, you're starting to do more cosmetic work as well. Well, what is next for you? I know you mentioned that you are engaged as well, about to go on holiday with your fiance. What's next for you?
So the personal side of things, I'm looking forward to. I've literally flying out early Monday morning with my fiance. So yeah, got a nice holiday planned. We're currently engaged. Getting married next year, October. So there's a lot of wedding planning going on at the moment, which I'm going to pretend that I'm doing a lot of, but really she's doing most of that. So that's all very, very exciting. In terms of my career, I'm pretty focused at the moment with my postgraduate diploma that's starting in September. I'm doing a postgraduate diploma in restorative anesthetic dentistry. So that's a year-long course. So I'll be focused with that and getting involved with the BADT more. Yeah. Long term, I'd like to get into speaking, teaching eventually, but I think there's still a lot more to learn and do along the way before I get there. But yeah, I think October I'm with HEE in Leeds, teaching pediatric dentistry, aspects of pediatric dentistry to fellow dental therapists. So I'll see how that goes, but that's really something that I think I'd like to get into, definitely.
Fantastic. And you've answered a lot. You've given us a lot of value today. If somebody still wants more, how can they best find you and get in touch with you?
I'm pretty active on my social media, so you can find me at Ibi Newman on Instagram, also Ibrahim Newman on LinkedIn if you do use LinkedIn, Facebook. I've got a website, inewman.co.uk. Just drop me a message. More than happy to help and support and share my knowledge.